Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel Health Education. Nowadays, we are discussing kidney diseases and their treatment. Today, we shall have second session of our discussion on renal transplantation. Renal transplantation is of two types, cadaveric and live donor. Cadaveric renal transplantation involves receiving a kidney from a deceased donor from a dead person, which expands the donor pool, but often has longer waiting times and slightly lower long-term graft survival due to ischemic injury before transplantation. Live donor renal transplantation, on the other hand, offers a better graft survival and quicker transplantation as the donor is carefully selected and the procedure is planned in advance. However, it relies on the availability of a willing and compatible living donor, which can be a limitation. While both options saves life, live donor transplant generally yield better outcomes. Live donor renal transplantation is actually practiced here in Pakistan. Now, I would like to share with you a true case history of live donor renal transplantation to explain what is it and what is its impact on life. Meet Mr. Jamal, a 38 years old father of two, who has been battling kidney failure for the past 3 years. Despite his best efforts with dialysis, Jamal knew that the only way he could survive and see his kids grow up was through a kidney transplant. Then there's Iman, Jamal's sister. She is 35, healthy, and would do anything to save her brother's life. After months of agonizing over the decision, Iman made a selfless choice. She would donate one of her kidneys to Jamal, even though she had no guarantee of how it would affect her own health. For Jamal, each day was a struggle. Dialysis drained him physically and emotionally. He missed family gatherings, could not keep up with his kids' activities, and constantly feared that time was running out. His family relied around him, but nothing could fill the void left by his declining health. For Iman, the decision to become a live donor was not easy. She spent months researching the risks involved, consulting the doctors, and even talking to her living donors to understand the procedure. Despite the potential complications, Iman knew that giving her kidney to Jamal was a gift that could change his life forever. I didn't want to wait until it was too late, she said. I wanted to do everything I could to help him now. After months of preparations, Jamal and Iman were both cleared for surgery. On the day of the transplant, they both underwent separate procedures. Jamal receiving Iman's kidney and Iman undergoing a procedure to safely donate one of hers. The operation went smoothly, and within a few days, Jamal's body began accepting his new kidney. The emotional weight of the moment hit both of them as they realized the magnitude of the gift they had shared. Within weeks, Jamal's energy returned. He was able to play with his kids again, return to work, and live a normal life. His kidney function improved dramatically, and his health began to stabilize. For Iman, the recovery process was a bit slower, but she felt empowered by the knowledge that she had saved her brother's life. It's hard to explain, Iman says, but it feels like the best thing I've ever done. Jamal and Iman's story is just one of many. Every year, thousands of people like Jamal need a kidney transplant. If you are healthy and able to consider becoming a living donor for your family member, you could save a life. Just like Iman, you could change the future of someone you love. So to summarize, Jamal had been on dialysis for nearly 2 years, struggling to keep up with life. His kidney failure was slowly stealing away his ability to be the father and husband he wanted to be. But then his sister Iman made an incredible decision. Despite the risks, she chose to donate one of her kidneys to Jamal, offering him the greatest gift she could give. After the transplant, Jamal's life was transformed. He regained his health, his energy, and his future. And Iman, she didn't just give a kidney, she gave her brother a second chance at life. Jamal and Iman's story is proof of the life-changing power of live donor renal transplantation. You could be the difference in someone's life too. This case history not only educates us on the process of live donor renal transplantation, but also makes it emotionally resonant. After discussing with you the case history of renal transplant, I shall end here and to see you tomorrow in the third episode to discuss important medical aspects of renal transplantation, which are relevant to general public understanding. Till then, take care. Khuda Hafiz.